So we obviously see a lot of patients that want on-X full arch implant treatments. And one common thing that we hear is, oh, well, I can go overseas to Turkey or to Mexico and I can do it for like $14,000. They think it's cost savings going to Turkey and paying, a lower fee for the treatment, but they don't think about the long-term costs. So I just want to let you know a few things to look out for when it comes to that type of, traveling over there and getting your treatment and then coming back. So one thing is when you travel overseas to get your treatment, they can do the surgery and then they may be telling you that you're getting your final prosthetic. The downside to that is when you come back to the US 3 months later, the gums have now healed. The gums have shrunk to their final position. So now if you have your final prosthetic that you got at the day of surgery, there's going to be space between the prosthetic and your natural gums, which could cause a whistling noise when you try to talk, and worse, it can be a trap food that's detrimental to implant health long term. Secondly, if there is something that goes wrong when you come back, no dentist or oral surgeon in America is going to touch it, unless you're willing to start all over again, which then it gets more costly because it involves implant removal, grafting, and it may not even be possible anymore. Thirdly, you do want to have a dentist or provider here that you can regularly see for checkups. So for us, for example, we provide a warranty for the treatment that we do as long as the patient isn't a smoker and shows up every 3 months for regular checkups. You don't want to spend some money and then all of a sudden everything falls apart and now you're back to ground zero or maybe worse.